is a third article from JEPM looking at the safety and efficacy of oral mirtazapine in New Zealand white rabbits, which are kind of our classic lab animal rabbit. So mirtazapine is a tetracyclic antidepressant. I want to say that it's kind of classified as something like, hang on, I have to Google this. Like its method of action. I'm pulling it up on Wikipedia because Wikipedia can be a really good source of information. Hang on. Noradrenergic and specific serotonergic antidepressant, although the evidence in support of this label has been regarded as poor. What? Okay. Anyway, we know that it's an antidepressant. It has antihistamine activity for whatever reason. It's an alpha 2 blocker, and it has anti-serotonergic activity. So the pharmacology of that gets pretty complicated because it's an antidepressant, and antidepressants are not simple. But basically, we use mirtazapine in many different animal species as an appetite stimulant. So one of the side effects, or I guess quote-unquote adverse effects if you're a human and you're really worried about your antidepressant causing weight gain, is that it makes you really hungry. But if we have pets who we need to eat, so cats who are just being cats, because sick cats often won't eat and they're really silly about it, and cats need to eat when they're sick. Specifically for anyone who doesn't know, cats who don't eat, they have a really short period of time before their body starts to catabolize fat and protein deposits. So they have a really short period of time where, oh gosh, the name is escaping me. We have, oh god, this is embarrassing. Hang on. Liver, protein. Shit. What's it called? The your storage protein in liver that your body resorts to. No. This is embarrassing. I'm forgetting this word. But there's basically a storage protein in your liver that your body resorts to during times of starvation. And the period of time between when cats kind of run out of that and then start to catabolize their body mass is really, really short. It's like something like 24 to 48 hours, so compared to like 72 or longer in dogs, and I don't know, it's like 72 to a week in people or something like that. So basically, what cats do, which is frustrating, and rabbits do this too, is that they start to break down those that body mass, so protein and different fats, and that sudden increase in blood fat concentration kind of overwhelms the liver even further, and excuse me. And then we can have fatty liver disease occur, hepatic lipidosis. So animals not eating when they should is a problem. Mirtazapine can also cause personality changes in some of our companion animals. So sometimes cats and dogs are just like happier on it, which is effectively like a side effect because we're using it predominantly as like an appetite stimulant, and in dogs and cats, like the side effect is that it's an antidepressant, which is really interesting. So these types of drugs are vastly like untested in our companion exotic mammals, companion exotics in general. So what this study is looking at is mirtazapine going to help increase food intake in these rabbits, because this can be an incredibly useful thing to do. Rabbits, just like our chinchillas that we already talked about, are hindgut fermenters. We really want them to eat. Sometimes they're not eating because of pain, because of stress, because of other physiological problems. And when rabbits and other hindgut fermenters don't eat, then we have all those horrible things like gut stasis and cecal dysbiosis and enterotoxemia, blah, blah, blah. All those different horrible sequelae of not eating. So for whatever reason, if your rabbit is not eating, is mirtazapine an option to encourage them to eat? So I would definitely kind of preface this with, this should never be kind of our core treatment for these animals. When rabbits or other hindgut fermenters aren't eating, there's an underlying problem. So although it can be really challenging to kind of consult with clients sometimes, so sometimes clients just want like critical care to feed their animal who's not eating to kind of get their gut going, and this isn't wrong for first aid. but we're not addressing the underlying problem. So is this animal painful? Do they need pain management? Are they having nausea? Are they having other physiological issues from systemic disease? So kind of just throwing appetite stimulants at a rabbit that's not eating is probably not very responsible. This is something that would be like an adjunctive therapy. So if we have a rabbit who's in hospital with a gut stasis for whatever health issue is going on, and we have our pain controlled, so the animal has adequate analgesia. The animal's in as stress-free of an environment as possible. We're giving them supplemental oral fiber through one of those products like Critical Care, Emerade, to kind of get their gut moving, to kind of get that ball rolling, and they're still not eating on their own, then looking at something like an appetite stimulant as an option. So what this study looked at, again, was actually a really small sample size, so just 9 rabbits, decent kind of split between sexes, 4 male, 5 female, New Zealand white rabbits. Again, this is a really common breed that we see in lab animal science. If anyone is unfamiliar with what a New Zealand white rabbit looks like, they look like the classic lab rabbit. They're white, and they're effectively albino, and they have like the red and blue eyes. So pretty typical looking bunny. They can be really lovely bunnies too. So they have really great attitudes. So they are doing a low dose of mirtazapine and a high dose of mirtazapine, 2 sequential days, 5-day washout period between treatment groups. Okay, so they did a low dose and a high dose with the same animals, but then they gave a washout period, so a period for that drug to kind of leave the system, and then they did the other dose. So they looked at fecal output, food intake, body weight before, during, and after treatment. So very standard kind of data points that we're looking at when we're considering, is this making them eat more? Is it making them poop more? So super interestingly, they pooped more, but they did not eat more. So there's no statistically significant effect on food intake. Who knows why? This is super weird. So really interesting, because now, does this have a place in clinical use? So it's interesting because it does kind of confirm that it doesn't work as an appetite stimulant, at least in rabbits. Will it work as an appetite stimulant in chinchillas and guinea pigs and degus? I don't know. In ferrets, I wonder, because ferrets are kind of a little bit closer to our dogs and cats. So although they're in the weasel family, Mustelidae, they're definitely carnivorous mammals, like they're in that carnivora and not in Lagomorpha or rodentia. So I don't know if this has a use in clinic. So it's good for these animals to be pooping, because when they're pooping, it means that their gut is moving, and we don't have a stasis, we're treating that stasis, because when poop doesn't move in the hindgut fermenter gut, then that's when bacteria start to die off. Those bacteria like to be fed. They like to have gut motility. So if the animal is pooping, I guess maybe we're lessening the chance of us having those nasty consequences of a gut stasis. Hard to say for sure. But yeah, super interesting. So they did notice a mild reduction in weight following treatment, again, probably because these animals were pooping more but not eating more. So that mass that's associated with having all of that ingesta or food in their gut is probably a little bit reduced. So that's maybe not like lean body mass loss, it's gut content loss, but it's still a weight loss, and that's significant. So really interesting. Good to know. Mirtazapine, probably not